Many practitioners believe clinical mastery comes from what they know and from learning more techniques. But Dr. Susan Clinton joins me today to share a different perspective. She talks about the powerful lessons that have come from decades of practice and how presence, curiosity, and simplifying your approach can dramatically improve outcomes. You'll hear how asking one simple question can uncover the real driver behind a patient's symptoms and why most patients only retain about 10% of what you teach them. If you want a refreshing perspective on how to create deeper patient connections and more meaningful results in your practice, keep listening to see how small shifts in your clinical approach creates big change. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody, and welcome to this episode. I am delighted to have with me today Susan Clinton. And Susan is a physical therapist. She's done everything. She's an educator, presenter all over the world. She is just a wealth of knowledge and has been on past Birth Healing Summit sharing her wisdom with us. It has been so much fun. And today she's actually going to be with us again this year for the Birth Healing Summit in May 2nd and 3rd. And I have brought her on board to talk about her clinical mastery and her lessons learned along the way. So welcome to this podcast, Susan. Thanks for being here.
It is always my honor to be here with you, Lynn. We have so
Oh,
much fun, so
I
much
know.
fun.
I love interviewing you. I love everything that you have to share, Susan. So thank you. And
Hmm.
so knowing that our Birth Healing Summit this year is about the inner work to clinical mastery, I thought it would be kind of cool to hear your story because you are a clinical master. You are a master in the clinical space. And you are currently sharing your wisdom with those that choose to join your, is it mentorship program that you have?
Hmm.
And so feel free to talk about that too, Susan. But tell
Hmm.
us a little bit about your journey and how you got to be where you are today.
Wow. Okay, great. And again, thank you for having me here. I'm always honored and humbled by, questions about how I got to where I got to. It's always interesting to do reflections
Hmm.
in your personal and your professional life. To me, you can't separate the two. You find a way to balance and enjoy all of the experiences versus wishing I had more of this and less of this. That would probably be the first lesson learned is that it's not about separating, it's about balancing from within instead
Ooh,
of I'm a work person here, I'm a mother here, I'm a person, a wife here, I'm a this person here. That it's all a matter of flow and blending back and forth across what we do. Every stage of our life, every time of our life brings in a spotlight to an area that we need to spend a little more time with, which means that when you're at home with young children, the spotlight is really more on that very young family, and work is still important. But there's a shift, where how is it as important to be achieving highly at work by chasing certificates and courses
yeah,
versus spending a little bit, enriching that time at home with your kids and enjoying the work where you are.
yeah.
Which brings me to like one of the themes that I think would be very good to kind of say here. There isn't a perfect stage of life, and everywhere you are, that's exactly where you need to be.
Ooh, I
And
love
it
that.
doesn't matter how much we know, it matters that we're present in the
Ooh,
moment with our clients.
wow.
And
Or our
because
children or our partner or wherever we
or
may
our friends, our
be.
community, all of those
Yes,
things. So
yes,
it's our presence that matters, and how do we maintain the resiliency to be present? And that's, I
mm,
think, kind of, everybody always wants to know what courses did you take and which,
yes.
job did you do and how did you work this in together and how did you get to here? And it was, when I reflected, I look back, it was like there were different stages of my life where I could pursue certain things and
Mhm.
where I just didn't pursue certain things.
You know,
And so and I think a lot of that was being life circumstances forced me to be more present when I,
yeah.
and to change and to grow and to maintain that growth mindset versus this is the way it always should be, and I need to keep trying to control it and make it this way because if I don't do it this way, then I'm not good or I'm not, hitting the marks or being the achiever or some
Yeah.
of those things.
Well, Susan, you said the key word there, trying to control it. And I just want to let
Hmm.
everybody know that Susan's topic for the summit this year is the illusion of control. And so we will be diving into more of that when we are together in May 2nd and 3rd. So I love that topic, Susan, because I do find that so many, especially women, are just so trying to control everything. And
Hmm.
really, what you talked about was being in the flow of the dynamic of our life, our where we're at, who we're with, and that really you're saying presence is the most important piece to all that. Is that
Hmm.
right?
It absolutely is.
Yeah,
There's so many things that happened around us so fast, and
yeah,
it all brings us back to that, those colloquialisms we've learned from when we were children, from grandparents and great grandparents and parents and friends and aunts and uncles and different people, readings that we did, different things where, and all of them are on, just take a moment to stop and smell the roses. How many times have you heard that and really thought,
yeah.
what does that really actually mean?
Mm,
Is that person just telling me to slow down, or are they trying to give me a deeper meaning? Like
yeah,
there's magic in that 10-second presence.
yeah.
There's magic in that. That builds neural pathways,
You
and
know,
it's
Susan,
important.
yeah, and I think it's also important for us to recognize when we're not able to do that, and then
Hmm.
we need to dig deeper to figure out what's really going on for us. And I want to just share really quickly, I had a hard time being present with my kids when they were younger. And I remember like my youngest son and we would play, I have this entryway, and we would play soccer or balloon volleyball with each other. And I remember playing with him and my mind going, I should do this. Maybe I should do this. Like this work option came in, like, and all these thoughts distracting me from being present with my child.
Hmm.
And that was always a constant struggle for me. And I'm sure a lot of people listening in can relate to that.
Hmm.
And
Or
go ahead.
Yeah, or being present with the client or trying to be present with the client when you're thinking about all of these other different things that have to be
Yeah.
done before I leave the work today, and this has to
Yeah.
happen, and I've got to be somewhere tonight at 6 o'clock, and right, all of the
Yeah.
things that that's
Yeah.
that blending that goes on. So finding those moments, and I'll present them as 10-second moments
Mm.
as just that I had a client name them and I told her I'm shamelessly stealing this from you. She goes, they're my micro bliss moments.
Oh,
10
I love
seconds,
that.
and she actually times to learn to do this because we were, working on how she could work this into her day.
Yeah.
And she said, the one thing that worked for me is I hit the timer for 10 seconds and I don't think about anything else.
Uh,
Just what I either breathe or she like does, something sensory, rubbing her fingertips together, touching her hair, touching her desk, just for 10
yeah.
seconds to just remove herself from the environmental challenges that she has
Yeah.
going on. And when you do that, it changes your brain.
Yes.
And it
Yeah.
makes it easier to do it in the future. So when you're feeling triggered or things aren't going quite so wonderful or you got that pit in your stomach or something happens, you have that ability to kind of like back out and breathe. And it's easier to do it because you've practiced it for so long. And I like to think about that like brushing your teeth.
Mm.
Uh,
Yeah.
does anybody tell you in your adult life to brush your teeth?
No, you just
You
do it.
just do it.
Yeah.
Why? Because you're conditioned to do it. What if we conditioned ourselves to do these 10-second mindfulness breaks
Yeah.
throughout our day? After time, it would become
just
Things we
second
just,
nature.
right, we just do
Yeah.
them. We
I
do them and then keep the intention on them to make them special.
I love this idea for even teaching our children to do this.
Yeah.
Like, as much
Mhm.
as we instill the reason we brush our teeth is because our parents instilled to brush our teeth all the time. What if we as
Mhm.
parents instructed our kids to do these 10-second microbursts? I love
Mhm.
that. Love
And what
that.
if we, as clinicians, providers, nurturers, wherever we are on the spectrum of helping or working with our clients, what if we ask the question instead of, oh, that didn't go so good today, or what do I need to do to get this one better? What if we asked our question like, what was really good about that today?
Oh,
What was
I
really good about that today?
I love the
Versus,
focus change on that.
mhm,
Yeah,
mhm. So
so
those are
important.
some, those are those are some of the pathways I have learned. If you want to talk about clinical mastery or personal
Yeah,
mastery or whatever it may be, of course, we're always learning and always changing. So
hopefully.
my path as a PT started off back in a pandemic that was occurring in the 80s, which was the AIDS epidemic.
Oh, okay.
And I had finished PT school and I was working for a local hospital and assigned to the ICU.
Oh,
You know,
wow.
we
Yeah.
in those days in acute care, you either were on the ortho ward or you were on the med surg ward or you were,
Yeah.
you had the ICU rotation. And so I spent a lot of time up there with a multidisciplinary team.
Mm,
So I learned very early on in my work that the best healthcare is provided by a team and
mm,
one that communicates with each other. So I learned from respiratory therapists. They had learned from nurses. We had physicians on our team. We had even the people who came to do the basics of things that were so necessary to change the trash, to
yeah.
bring the food, to clear the tables, to do the things. We all had to be working in coordination for these people because nobody knew what to do. And we were figuring it out as we went. And one of the things I learned from those early years was that my clients were my best teachers,
Yes.
always.
Yes.
I
Always.
learned more from them, and I learned more about life in those 2 years than I
Mm,
think I don't even, I'm sure I've had other moments like that, but those were the
yeah.
most impactful on me at that age,
Yeah.
because I learned how fragile it was, but I also
Mm,
learned what deep meaning it had.
yeah.
And, and that working in concert with others, we were able to elevate care and provide support that wouldn't have been there otherwise. So
Wow. That's
that had a large
awesome.
impact on me as I move forward. I've moved from acute care into the world of rehab back in those
Mhm.
days and into the early, into the 90s and the late 80s. And the Glasgow scale had just come out, and we were looking at traumatic brain injuries in a much different way. And again, team approach, systems approach, and neurological injuries and spinal cord injuries. And so I was always part of a team, always multidisciplinary within that team, and learned so much from not only the practitioners around me, but again, our clients, what they went through and how much they could change. And if you followed their lead, they would tell you what you needed to know.
Oh, stop right there because
Uh-huh.
I want you to say that again, Susan, because that is true in every setting.
100%. Your clients will help you understand what you need to know.
Yes.
So
And
they were
so
always
our
my
job
best
there,
teachers.
the,
Mm-hmm.
the clinical mastery really comes in being able to listen
Mm-hmm.
to what our clients are saying.
Mm-hmm.
Oh, I
Yep.
love that.
So listening is huge, but active listening,
Mm.
taking it in,
Okay, so
and
tell me
then
the difference in your
yeah.
mind.
So passive listening is what you were talking about with playing volleyball, air
What,
balloon
yeah.
volleyball with your children, right? You
Yes.
were passively there playing the game, smiling, laughing. A part of you was there, but your intention was somewhere else.
Yes.
Right. So active listening is to put everything that you have to the side
Mm.
and give that moment to the person to tell their story or to tell what they need. And then the
Yeah.
second piece of that is asking questions, being curious.
Mm.
Instead of
Yeah.
telling them what's wrong, ask them what they think is wrong.
Yes.
Ask them what they want. Ask
Mm,
them simple things, like,
yeah.
what are you worried about? Because people are going to always, one thing I've learned through this whole thing is that people will give you the cursory answer first.
Mm,
I just want my pain to stop.
yeah.
First thing, I just want this to be better. I, you
Yeah.
know, I'm here to heal this up so I can move on. What does move on mean? Move on to
Mm,
what?
yeah.
What's not happening? People will give you the answer, oh, I can do everything. I just do it in pain. What would it
Mm,
be like to be able to do all of those things without the pain?
right.
Right?
Right.
So
Yeah.
just being super curious as to their journey and
Hmm.
figuring out what they want, what they know, and what they're really worried about.
Yeah.
And those three questions can change the game for you because research has taught us that humans will only take in about 10% of what they hear. And I wish it was more, but it isn't.
Yeah.
And every class that I took, I wanted to have all 100% of the stuff. When I teach, I know students want everything that I have to say. And I also know that they're only going to come out with about 15% that day. And by the end of the week, it's going to be 10%. So, one of the things that I learned and changed through my clinical life as I left rehab and went into outpatient and eventually pelvic health was I learned a couple of things. Number one, um, stop over educating people.
Okay.
And
Yeah.
that's a big one for pelvic health because we're like, we can educate all of our clients to understand all this really good stuff, and they
Yeah.
can't hear it. It's too much. And
Yeah.
so if they're going to only hear 10% of what I say, I want to simplify and make sure that that 10% is what they walk out the door with. That's the talking points I want them
Yeah.
that we collaborate together on as the most important ones. So they see the relevance of what it is they're being, whatever prescriptions we're giving them for movement
Right.
or self-mobilization at home. They have to have relevance for that. But also they need to know that they can do it easily.
Yeah.
It's got to be safe, and they get to determine what's safe, not us.
Yeah.
Our clients determine what is safe for them. But when we do that and we start working at those talking points, you can do this in your own clinic and I challenge people to do this because it was a game changer for me.
Ooh.
I started asking my clients at the end of the hour I spent with them, or 45 minutes that I spent with them, what their take-home message was.
Okay.
And I can tell you that it was a very hard exercise to do. You have to step out of judgment for yourself because they're telling you the truth.
Right.
And so don't be in that fixed mindset where it can't change and they're just wrong. But look at that as like, oh, here's the challenge. Because the things that came out of their mouths, I was like, this is what you're walking out the door with after this hour that I have like poured my educational life into for you. You're
Well,
walking out
well,
the door with this. It's like, oh, this has to change.
well,
So,
that's, I love this. I love this, Susan, because, well, as a practitioner, you have to be brave enough to ask that question and even braver to take the feedback of what they're saying
mhm,
and go, that is so not what I wanted you to walk away with. So, what needs to change in me to get a different answer from my client? Wow.
exactly,
I
exactly.
love that.
So that was hard to do, but it was also very interesting because if you could get out of your way and step back, it became kind of like a social experiment in a way. And I started learning that, okay, so what we're doing together, these collaborations, are more like experiments versus I'm the prescriptor and you're the getter, you're the
Yeah.
receiver and you're going to go and do these things. And then so people can, people talk a lot about, oh, high cancel rates and this and that. And it's like, because they don't see relevance in what it is that is
Mhm.
happening. They're being
Yeah.
handed a list of exercises that you yourself can't possibly do in your busy day.
Yeah.
So the collaboration, that listening, curiosity leads into collaboration. Out of these things we've talked about today, which are the most relevant to you?
Hmm.
Which one would you like to focus on? They get to choose the focus. Well, I'll do everything. we can't do everything. It'd be nice,
Right.
right?
Yeah.
So let's
Yeah.
pick one, you know,
Yes. Yes.
allowing
Yes.
them
Yes.
to be able to say, oh, okay, I can't do everything, but I can do this thing. And it's
Yeah.
like, if this is the thing you want to go with, let's go with it. And let's talk about why it's going to help you do that thing that you're expecting or hoping to get out of these sessions together. So
Yeah.
we're establishing relevance, we're establishing safety so that they can collaborate in what they want to do and how they can get it done. And, and if we have those two conditions there, they're more likely to be consistent with it. And
Nice.
think about all the things in your life. Even in the midst of everything that's crazy, you manage to brush your teeth.
Right? Twice a
Right?
day.
Some people 3 times a day.
Yeah.
So
Yeah.
there's time. I don't
Yeah.
have time to do this. It's like, let's time it.
Yeah.
Let's see how
Yeah.
much time it actually takes, and then
Yeah.
let's see where we can fit it in. But you
Yeah.
don't have time to do these exercises in that way during your busy week.
Hmm.
Could you do these at another time? Oh, I could do these on a Saturday. Great. So Saturday you do these, but what are you going to do during the week? Which one
Yes.
can you fit in? How can you do it? Collaboration is the key for helping people make changes. And it
Mm.
could be, just as simple as drinking water. We manage to brush our teeth twice a day, but do we manage to get in nice hydration, not overhydrating, not 5 liters of water,
Right.
but maybe 4 glasses? Are
Yeah.
we really doing that? We manage to get to bed at night. Do we manage to get to bed in a way that's going to make our sleep a little bit more efficient?
Mm.
Right? So we're
Yeah.
already going to bed. What can we habit stack onto bedtime for our clients and for
Well,
ourselves?
yeah.
Because we are our clients that can make their sleep more efficient, can make my sleep more efficient.
Well, that's what I so resonate with the occupational therapist, Susan, because
Hmm.
what I'm working with postpartum women, and I really got this from Katie Bowman, and that,
Hmm.
15, 20 minutes of exercise a day doesn't change what you're doing 95% of the day. So
Hmm.
let's change how we're doing each and everything we're doing throughout the day.
Hmm.
And, so I'm really all about sit to stands, picking up babies, like we're
Hmm.
doing that already. Let's incorporate that in. So make it functional, make it applicable to what they're doing throughout the day. Because we can either be
Make it
doing it well,
relevant.
making it relevant. Yes, absolutely.
Is relevance the key?
Yeah.
And again, they're already doing it. People talk,
Right.
about all kinds of, oh, should somebody with us, that has a C-section be doing an exercise like this? And it's like, have you looked at how they're getting in and out of bed and up and down and putting their clothes on and picking up the child? There's where you need to be because
Right.
this is what's important for them.
Yeah.
And I'll just tell this story because I think it's super important. When I asked a lovely lady who has a 2-year-old son and was pregnant with her second child, and she's 5 months pregnant and having SI joint pain, so to speak, pubic ramus pain. That everybody's mobilized her, everybody's manipulated her. She's a PT assistant, by the way, and she just couldn't figure out what was going on and really kind of stuck in a. I have to make it pop in order to feel better.
Mm,
And I asked her a few questions, and the one question I asked her, I said, "What in your heart of hearts, what are you seriously worried about? What are you
mm,
seriously worried about?" She goes, "I I'm seriously worried about being on the stairs and dropping my son."
mm. Oh, I
And
just got the chills.
I just sat there with her and I said, "Tell me about that." And she said, "I had a PT once who told me that who was pregnant that said, that be very careful because if your pelvis gives out and you're on the stairs, you could fall down and drop your son." So you can imagine what we started working on from day one.
Yeah.
It's like, tell me about the stairs. Show
Yeah.
me how you carry your son. We
Yeah.
needed to, if I didn't address that, it doesn't matter. All the mobilizing in the world isn't going to change the fear that's running this piece behind it.
Yeah.
So the whole, talking about, and of course I've worked with OTs and speech therapists and,
Yeah.
recreational therapists and psychologists and psychiatrists and neuropsychologists and, I love the multidisciplinary
Mhm.
approach. But this person needed to really, and it was a game changer for her.
Mm,
As she
yeah.
walked out the door, I said, "What are you going home with?" She goes, "Nobody has ever talked to me about how to do the stairs and take care of my 2-year-old while I was pregnant."
Wow.
She goes, "You're the first person who did that." And it was like, actually, you did that because you were brave enough to tell me what you were worried about. I was
Yes.
just the first person to ask you,
Right. Well,
right?
t 2 points to that story, Susan. Careful what we say to our clients,
Yes.
And then, asking, being brave and willing to ask that question, what are you most concerned about? Wow, that's impactful. I love that.
hmm And you learned so, and if that wasn't an issue for you, what would that do for you?
Mm, yeah,
Right? And then you get
yeah,
down into the real deep stuff of what's going on.
yeah,
Everybody wants to stop leaking, but nobody's asking them really what they're worried about with it. And there are stories back there that
mhm,
when they feel safe enough and brave enough to be able to share those, it's such a release for them that then they
yeah,
can see the relevance of doing some simple exercises and making some changes here and why we stand on one leg when we're brushing our teeth because it's going to help your pelvic floor and hips get stronger, right?
yeah,
Then it
yeah.
starts to make sense and pull it all together for them. So I would have to say my path to where I am today has led me into collaboration and coaching
Hmm.
along with physical therapy services. So I coach healthcare practitioners to, find the peace and joy back in their life again, feel inspired again, take care of themselves while
Yeah,
they take care of others, find that those values and guardrails so that they can have the passion in their personal life as well as their professional life. And oftentimes people, because they embrace what's actually going on, they see clarity in it versus trying to control it, which
mhm,
eludes the progress.
yeah,
So the one thing that we know in life that is inevitable is change.
mm-hmm.
It's
Yes.
the one thing we can count on, and it's the one thing we try to prevent at all
All
costs.
costs. Yes. Yes. It's so
That's what you
true.
talked earlier about the flow and the go. Things are
Mhm.
going to change, and the moment that you're feeling now is not the moment you're going to feel at this same time tomorrow. You're going to be feeling
Yeah.
something different.
Yeah.
So rather than running away from it, embrace it and feel
Yeah.
it, and then ask yourself, what's my gift and opportunity here to change this,
I love
right?
that.
Or to
I,
expand it. I want to bring
yeah.
the sunshine with me the rest of the week,
Yeah.
or whatever.
Well, and I would want people like what's coming to mind for me as you talk about that, Susan, is my personal reaction to change is I have an initial like no. Like that's just like
We
my
all
initial is
do.
like, oh no, I don't know. But then I sit with it and then it's like, oh, okay, now I can make the change. So I
hmm
recognize that. And I've talked to my team about that and just
hmm
say, just so you know, like this my initial reaction to most change is like, but yet I soften over time. So like just be aware of that. And I'm aware of that as my reaction. And so
hmm
I really looking back, I don't remember having as big of a like ah! to most things. But if I do, I just notice that's my reaction.
hmm and it's hardwired into every human system. It is hardwired in our sympathetic nervous system because that system absolutely 100% is there to protect us
Yeah.
and to keep us. And so it doesn't understand or want to change. It wants
Yeah.
things to stay stable so that the heart beats and the breath comes. It's its job. But it's
Yeah.
a simplistic piece, it's a protective piece of our system. We want to honor that. Like,
Yeah.
okay, why am I having this reaction? Right? Oh,
Yes.
because I'm so used to doing it this way, and it feels so uncomfortable to make a difference, to make it, to
Hmm.
change it. I'm standing on the edge of our comfort zone isn't comfortable. I want to crawl back into my comfort zone
Yeah.
and be where, kind of like the chair with the blanket and, taking
Yeah.
care of myself. And it's like, okay, what is causing this? And so it's the same thing while we're treating clients. Why are we getting so triggered? Right?
Right.
If somebody
Yeah.
isn't changing or they're not moving along the spectrum in a way that makes us feel better, And it's like, okay, so this isn't about me, it's about them. And I need to be sure that I'm not co-regulating to my clients, that
Mm.
I want to co-regulate myself. And if they want to co-regulate with me, great, right? But I do not need to go co-regulate with them because
So,
that's not going to help them.
okay, so what you're talking about there is you going to them versus them coming to you as far as like that regulation, that
Right.
energetic resonance
So,
with
like
one
when
another.
somebody's angry,
Oh, yeah.
right?
Yeah.
Or they're upset or they're, and you get all
Yeah.
triggered because of that,
Yeah.
defensive, that's you co-regulating to them. And so maintaining your center, your presence, taking care of yourself is what allows you to have the resilience to allow them to be triggered if they're triggered, but
Yeah.
to also not play into it, right? It
Yeah.
takes two to tango.
Yeah. Yeah.
It
Well,
takes
and
two to tango.
yes, and being aware of where you are at and how you're reacting,
Exactly.
right? And your inner state. And truly, everybody, that's what our focus is this year at the Birth Healing Summit, May 2nd and 3rd, is your inner work, the inner game to clinical mastery. It's like we have got to work on that and focus on that. Susan, how much? So you're talking a lot about this resonance and your connection with your clients. What did you notice in your clinical practice? Because what you're interviewing, those questions that you ask your clients, that's really going deep with them,
Mm-hmm.
right? Like
Mm-hmm.
that's going into their psyche in a way, like what they're thinking, feeling, and their fears. What did you notice in your outcomes when you started to go there versus just keeping it clinical and going, oh, your pelvis is rotated this way and you've got this lack of range of motion, your strength isn't good. Do you know what I mean? Keeping it on that clinical level versus taking it deeper. And what was your experience with that?
Three things. One, I was much happier
Ooh,
because I was not the fixer anymore. And it
ah,
wasn't on me to fix anybody. It was
oh,
on me
that's
to be
important.
present with them and to collaborate and have empathy for you can't have empathy for others without empathy for yourself.
Ooh,
So
I
you
love
have to
that.
have self-empathy is key to everything. And it's key for the situation and it's key for empathy with others. And I developed a better empathy I had compassion for my patients, my
Sure.
clients, but I gained so much in the world of empathy to be able to sit with them in that. I didn't have to have the answers. I
Mm,
just asked them simple questions such as, what kind of support do you need?
yeah,
As they
yeah,
would tell
yeah,
me whatever it was. And, how, is this something that you want to address in our
yeah,
sessions to make sure
yeah.
this doesn't happen or this isn't your future or whatever
Right.
you're imagining there and whatever they're worried about? Um, so those were two things. And then the third thing was that I, it wasn't difficult to work with clients that were difficult. I learned
Yeah.
that the more complex they were, the more simple my approach became.
Oh,
Because when you
interesting.
try to tackle complexity, you can't do it. Back to the
So,
toothbrushing thing, right?
yeah,
What's the
yeah,
one thing that you
yeah,
do that you can do? Like, what is the one thing we can start changing? And I talked to them about if we can get the needle to move 1% in this direction, can you imagine if it moves 1% every day, what that's going to look like in 2 weeks?
yeah, yeah,
And that's all we need to do is just a little bit. I know you want the world, and I
right.
want the world with you. We're going to get there though by doing these simple things because these are what's going to actually make the changes. And a lot of times, many of the fears around the complexities and certain things changed. My clients were truly happier, I think. They still
Mm,
are. They still, and I
yeah,
have found that the power of just laying things out on a timeline and really listening to their story and collaborating with them and moving through things takes away so much of the barriers. And
mm,
they're just so, I have a client right now I'm working with that is working on, her documentation. She's just was so hijacked by it. It hasn't changed. She's changed a couple of little small things within it, and she just feels like she just has so much more freedom.
yeah,
Right? That's the
yeah,
power of doing like the simple things, pulling those simple things out. and really helping people find that footing. Because once we
Mhm.
start changing in one small direction, guess what happens?
Big changes happen.
Big change, things start
Yeah.
changing all over the place.
Yeah. Yeah.
People
Yeah.
respond differently. They do different things. People in your world respond differently. They do different things.
Yeah.
So
Yeah.
yeah, so
Yeah.
that's what happened there.
That's awesome. That's
Hmm.
awesome. And I love you said, the empathy came from within you to be able to have that for your clients first. Like it came for you first to be able to have it for your clients. And I'm talking about the Birth Healing Summit that we can't take a client down a path that we haven't walked ourselves,
Hmm.
and
Right. I
so
don't have to have their pain, but I can't have empathy for them if I don't have that empathy for myself.
yeah, yeah,
Right.
yeah,
And that's generally in my writings and my things that comes up, when I'm having a hard time and this isn't going right, or I feel like I'm gonna lose my stuff, and it's like, whoa, Susan, where's this coming from? Why are you
mhm,
having this anxiety again? Why are you over functioning? Where is this, and it's like, oh, okay. So I am not practicing this and over here where I need to be practicing this, and it's building up over here now. I had enough to get through for a little bit, but it didn't
yeah,
work over time. I've got to keep it going over here to keep it going over here. And I love my meditation practice, but I don't have to have it every day. But I
mhm,
do need to have that mindful work every day.
mm,
And so I choose to do it in the moment during my days because that's what allows me to do that. Like you said, that step back from that, oh no, I don't want this to happen. I have that, using that mindful tool that I use, just really helps me kind of like calm down, take a deep breath,
yep.
feel it. It's okay. You know where
Oh,
this is coming from. It's okay to feel this. Like you don't have to run away from
yeah.
it.
That's the key, right? Is being
Hmm.
okay with our feelings. I feel a
Hmm.
lot of issues that people are running away from is their feeling. And
Exactly.
yeah, and really exploring what is that about for you? Like how do
Hmm.
you feelings weren't honored in my family growing up. Like it was all swept underneath the carpet. And so
Hmm.
over the years, I've really had to become more comfortable with just being able to feel emotion in me.
Hmm.
And so, yeah, I encourage everybody listening in. How are feelings for you? How do you approach and how do you react to your own feelings that are wanting to come up and be known to you? So, oh my gosh, Susan, this has been incredible. Is there any last tidbit that you would like the listeners to know?
That where you are at this moment is exactly where you need to be.
Mm, I
You
love
are
it.
perfect just the way you are right now.
Yeah.
And you have choices in front of you. And there are always choices and possibilities. And just make sure that the choices and possibilities you look at are ones that are going to get you to the path at which way you want to go.
Mm, I love
Sometimes
that.
we make choices based on things that aren't going to get us there.
Yeah.
And, so sit with those. They don't have to be decisions. You don't have to kill anything off. They're just choices. Play in the possibilities of what you want and make it tangible for yourself.
Yeah. Oh, I love that. I love that. Oh my goodness. So much wisdom in this, I think 40 minutes that we've been together, Susan. This has been
Such a fun
incredible.
conversation.
Right? Isn't it? It's neat to look back and like you said, the choices I've made over the years in my career and how they all kind of help to support me in working with postpartum women and being able to discover what I was discovering with them. You look
Hmm.
back and go, oh, that was so perfect. So
Hmm.
yeah, it's just so fascinating. And yeah, we could continue on and on and on. And we will. We will have another amazing session at the Birth Healing Summit this
Yep.
year. And you're talking, do you want to just share real quickly what you're going to be tapping into during our time
Sure.
together?
Absolutely. We're going to have a nice, wonderful conversation about being a provider and the illusion of control, but not just so much the illusion of control, but what to do about it and
Yeah.
how to change and reframe. And then we're going to move into kind of a fun workshop of discovering kind of what your tendencies are. I like to call them
Mhm.
saboteurs from the positive intelligence world, and how you identify your values and a behavior you want to change, and just taking it through that piece so you can do that 1% thing that I just talked about.
Yeah.
Where can you make that 1 to 2% change in something that you don't appreciate in your life, or you feel like it's
Mhm.
holding you back, or a situation that you're in, or a distasteful piece that's happening that you have to do. How can we reframe that, use the growth mindset, and bring that forward into a different possibility?
Wow. And so, just so everybody's clear, this is not just you listening to information. This is going to
Right.
be an experiential
Hmm.
session where you're going to be doing the work. Susan is
Yep.
going to be guiding you into doing your work to help you make the changes that you need to change to show up and help you to hopefully release that hold on control that you have in your life and whatever else might come up in your sessions. But it's really a deep dive into yourself. And each session is going to be an opportunity for you to do your own work. And
Yep.
you will be guided by these amazing, amazing speakers. And you've just heard from Susan. You'll know that it's going to be powerful. And I am just super excited about this event. So thank you, Susan, so much for being a part of it. I'm super excited for the value you're going to bring to our session. And it's going to be amazing, everybody. And we'd love to have you join us. So please check out the sales page. It'll be in the link in the bio or the link of the show notes for this podcast. Please check it out. And the early bird registration ends end of March. So you can get it at the greatest value in March. And we would love to have you join us. So thank you, Susan. Thank you for your time here. And we will look forward to seeing you May 2nd and 3rd.
Thank
So,
you. Always my honor. I
uh,
appreciate it.
thank you. All right. Thanks, everybody, for listening in. And we will see you all in the next episode. Take care. Bye bye. Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.